Okay, good afternoon. Welcome, everyone. Welcome to an orientation for CPES. Before we get started with our guest speaker from CPES, I thought it would be a really good idea for those who might be from a lot of different sectors from across Connecticut. We have a wide range of people joining us today. It's really exciting to see how many different sectors and parts of our Connecticut landscape are joined and registered for today's presentation. So really quickly, I just wanted to put CPES into the broader realm of Connecticut's prevention infrastructure before I kick it over to our guest. Can everyone see that? So, ooh, So for those who may be less aware of Connecticut's prevention infrastructure, we have a very multi-level system between the national level, the state level, the regional level, and the local and community level, all engaged in different parts of Connecticut's ecosystem and prevention. On the federal level, we have different agencies that engage in substance misuse prevention and prevention in general, such as SAMHSA, HRSA, and CDC. The Substance Abuse and Mental Health Services Administration, otherwise known as SAMHSA, aims to prevent initiation of substance misuse, prevent progression of substance use, and prevent and reduce harms associated with substance use. At the state level, we have a rich array of we call them resource links that are partnered together and collaborate on these efforts, such as Problem Gambling Services, CERC, which is the State Education Resource Center, ourselves here at TTASC, the Wheeler Clinic, CPES, who we're talking to today, and GPP, the Governor's Prevention Partnership, all working together in collaboration on these issues at the state and local level. At the regional level, we have what we call our Regional Behavioral Health Action Organizations, or RBHAOs, who really serve 5 different areas of our state, coordinating the prevention infrastructure in local communities. This is a map of the 5 different regions of Connecticut in which RBHAO services your community that you may work and live in. And on the local level, really our boots in the ground down at the community level, we have our local prevention councils that we call LPCs and community coalitions, who engage in 12 sector collaborations, uniting different parts of communities, all working together towards common goals, and empowering local solutions and strategies that work for each of the communities based on their needs. So with that, what I'm going to do is kick this back to Jen Sussman and kick that over to you. Sorry, I'm just trying to stop screen share. So Jen, welcome. Thank you for being with us today. Jennifer Sussman is with CPES, and I am going to move this over to her for her presentation as we do a deep dive into her organization in Connecticut. Hi, Jen.
Hi, Jen. Thank you so much. So it's interesting because TTASC and CPES are sort of the birthday twins of resource links. So we kind of came up under DMHAS funding at the same time. So I kind of feel a kindred spirit with them. So I'm just going to share. It's really excellent to see you all. There's some new faces here. So I'm really happy to kind of get the word out on kind of our sense of the work. All right, let's try this. All right, So I'm Jennifer Sussman. I'm the coordinator of the DMHAS Center for Prevention, Evaluation, and Statistics, fondly known as CPES, at UConn Health. And I'm here to talk to you not just about CPES, but about data and the data landscape of the state of Connecticut and beyond. So first of all, the acknowledgement, that as Jen said, we are funded by the Department of Mental Health and Addiction Services Prevention and Health Promotion Unit through Substance Abuse Prevention and Treatment Block Grant funding from the Substance Abuse and Mental Health Services Administration, SAMHSA. Thank you again to our resource link partner, TTASC, for hosting this Lunch and Learn and the series and inviting us to share our work. So by the end of this session, the hope is that you will be able to recognize the role that data plays in health promotion processes and prevention work, and then identify a few public access points and resources for behavioral health data. that might be relevant to your work, and then understand the role and the offerings of CPES as DMHAS's data and evaluation resource link. So first, and we're going to use the reaction buttons here. So find your reaction buttons. What would you say your relationship is with data? And just raise your hand. Raise your hand if when you see sort of what reflects your relationship. So first of all, I love data. Data and I are besties. Any folks in that camp? And Jen, I can't see reaction, so you'll have to let me know. um, how about I'm an expert at utilizing data?
We've got some hands up.
Okay, so
Heart.
nobody's besties with data. We get that far.
Well, we got a couple thumbs up and a heart.
Okay, awesome. I'm comfortable using data, but feel I could be better.
Yep.
Okay. I am a newbie to the data world. Any newbies out there?
3, 2. Yep.
Okay. Data, what's data? And then finally, ugh, data.
I don't see anything on the last two coming up. So
Okay,
you're
okay. All right. All right. So be honest. Um, I love this graph because it definitely reflects what we kind of see in our work sometimes. So if this is what you see when you look at a line graph, we can help. So this is the view of what you might see if you looked at a mountain range through a tennis racket. Sometimes data looks like that. So just so you know, if that's what you're seeing, you're definitely, you're in the right place. So, for those who are thinking about data in very complex terms, which I know many of us do in the research world, it's just information collected for use. So, it has a number of different uses, which I'm going to go through in just a minute. And one of the ways we use data in the prevention infrastructure is through the strategic prevention framework. And for those of you who haven't seen this before, this is a prevention strategic planning and implementation framework that that SAMHSA uses for its prevention work. And as you can see, it's the wheel of that is not linear at all, but basically we generally start with assessment and capacity building, move on to planning and implementation, institute evaluation practices, all the while keeping mindful of sustainability and cultural competence. So there is also an equity aspect to this that is not listed here, but it's definitely something that we keep on our radar at all times. So data has a role in each of these processes, and whether you use the SPIF, the Strategic Prevention Framework, or some other planning process, data can be applied to all the steps. So, for one, in the assessment phase, data helps you prioritize problems and community needs. When you move on to capacity building, you can use data to build or increase community buy-in. So, and also community readiness, quite frankly, by raising awareness of the issues, using data to help people understand the magnitude, the reasons why this is an issue, who's affected, and kind of where your community is at a starting point. And you can do that throughout this process. So like I said, this is really not a linear process. It's definitely cyclical. So by the time you get to the planning phase, you're using that needs assessment data and your community buy-in to prioritize risk factors and identify strategies to address those risk factors. And risk factor data is one of the things that we're highlighting today as well. I'm shifting to the middle of the flower at this point because really at this point you cannot go any further without identifying populations of focus and identifying health disparities that really are connected to those risk factors and will apply to your application of strategies to address that. So, and then in the implementation phase, you're going to use data to guide adaptation of EBPPPs, which are just evidence-based policies, practices, and programs. You'll also be using data to increase community awareness. We're going back to that capacity pedal again, to buy or increase community buy-in. And also to inform social marketing, informing whatever it is you're doing. You're going to need data to either incorporate into your social marketing or to identify where to focus. Um, and then evaluation, and again, this I can't stress enough that this is not really a linear process, or even a strictly cyclical process, because you have to think about evaluation earlier on than after implementation. So, but for evaluation, you're using data in the ways that probably people are most familiar, to measure success, to prove the value of your efforts, to improve your efforts, to see where you need to make changes. And then sustainability, you're using that same data to demonstrate value, to secure additional funding, to show the impact, not just for funders, but for your community members. And it's that buy-in that also will help with sustainability of your efforts. So the kinds of data that we use in prevention and health promotion fall into a few different categories. So there's that prevalence data. There's the data that measures the existence of the problem. So your surveys, your statistics, your overdose data, your student survey data, health department statistics, for sure. And that applies to disease, that applies to, other areas of focus that are not specifically substance use and prevention and mental health promotion. Applies to disease prevention, epidemiology in general. And then we move on to incidence or consequence, which are sort of what are the effects of the issue? Hospital data, treatment data, motor vehicle crashes for alcohol and other drug use. And then the risk and protective factors, which are really the all-important causes. Why are these issues happening? What is it that you can address that keeps the issue from happening, as opposed to just addressing the issue? That's the difference between prevention and treatment. And also resilience factors. How do we strengthen our communities and the members of our communities in the current landscape? That's probably the most important thing I can think of doing right now. How do we address health disparities? How do we raise up those in our communities to be able to deal with what's going on in the world? And then community attitudes and beliefs, and that's that buy-in piece. That's, what do we address about what the community believes that increase community capacity, that help us get at the root of what the issue is and change the thinking about it. So data applied to that is super important. And then, of course, the social determinants of health that we talk about all the time. But really, what are those structural and societal factors that apply to all of this? And then finally, data on capacity, resources, gaps, and needs. What do you need to know about your communities, what they have to offer, where they're, the problem areas are, where there are deficits that you need to address before you even start the work. So moving on kind of where to find these data, most of the publicly available data can be found fairly easily. And the bigger issue is there's so much of it. How do we make sense of, of all the data that we have around us? I'm not going to talk about being an educated consumer of data. That's an entire other presentation. But that being said, data portals, they contain data from a variety of sources. It's kind of a library approach, one-stop shop. And that can be helpful in seeing everything that's out there. Dashboards, which are more interactive, they allow visual comparison of data elements, but usually are focused in one or two particular areas. Reports and articles, they do the analysis interpretation for you, but you don't have access to the actual data. And then state or national survey data, which we'll talk about in a little bit. And those are your national youth surveys and risk factor surveillance surveys and those sorts of things. Proprietary data, which is data that has to be accessed by request, which is not publicly available, comes generally from the state agencies, community partners, researchers, universities. That's data that needs to be accessed not only by request, but by relationship building. And then we have our locally collected data, which is the data that you all have more control over. And that's the data that's gathered from within your community via surveys, focus groups, and listening sessions. Going back to the definition of data, that's conversations. That's anything that you can document community perspectives in some kind of systematic way. So don't think the data is kind of up here, when data really is all around you, and organizing it is how you make sense of it. So let's go to dashboards for a second. I'm going to go through these quickly, just because I wanted you to have these as a resource, and all these slides are linked. So when you get back to when you get this presentation, you can go and play as much as you want. But so the data dashboards, two that I wanted to highlight were really the Connecticut Suitors Overdose Dashboard, which is maintained by the Department of Public Health. And it allows you to really kind of toggle through substances of focus in overdoses to different areas, from county to health department to city. Look at things by race, ethnicity, age group, sex, date of death. And you can look at all the years. So the little, the circles around down the side of this dashboard allow you to focus in on a year. You can get raw numbers, you can get rates. It's a fabulous resource. It's kind of buried in the Department of Public Health website. And the other, that's just because it's sort of fun to play with. We use this a lot in gathering data for underage drinking and driving under the influence of substances. These crash data dashboards allow you to look at motor vehicle crash details. And these are relatively new, these crash summary dashboards, vehicle summary dashboards, and you can look at them by the vehicle, the crash, or the person, and set categories, and really you can look at your town, you can look at your region, you can look at by individual case. So just wanted to kind of draw your attention to these because they're kind of fun to play with. Moving on to portals and repositories. I'm not going to go through all of this. These are the summary slides, and then I'm going to click through some of the views of these actual resources. But the Connecticut Open Data Portal, the Connecticut Data Collaborative, Department of Public Health, State Department of Education, EdSite, Data Haven, and then our prevention portal. So first of all, I'm going to switch over for a second to the national resources. We're not going to be spending time on these. One of the things that I will say about these resources, they're constantly changing. So I checked the links this morning and they all work. But as we know, with the national climate and administration being what it is, these things come on and offline pretty much, from week to week or month to month. So I wanted to highlight the National Survey of Drug Use and Health, which has national summary data, and actually that's now, as of last week, it's 2023 data, summary trend data, and then sub-state estimates, which are really the DMHAS regions. Unfortunately, those have not been updated since 2016 to 18, so we're waiting for those to come out. And then the SAMHSA data archives for past year data subsets they're still active at the moment, their data tool, but I'm not sure whether that will be the case next week. And then similarly, the CDC Youth Risk Behavior Surveillance System, so that's the YRBS that we talk about, has summary data at the national level and by state. That data at the state level is also available on the Department of Public Health website. And there's a data explorer tool for the national and state level data. And then CDC Wonder, which has a variety of different sources of data. And then Kids Count Data Center, which is not something you might be as familiar with, but if you're looking for data on children and families at the national and state level, the Annie E. Casey Foundation has created this data center for use for those purposes. And then finally, it's not a portal or repository, but the Trevor Project. I have to highlight because it's one of the only national survey-based sources on the mental health of LGBTQ youth, and that data is up to date as of 2024. So drilling down for just a minute, Open Data Portal is managed by the Office of Policy and Management. It's legislatively mandated that state agencies share their data, identify a state agency data officer, and share data. Now, what data is can be pretty much whatever they decide it is. The data is organized by topic. It's not prevention, health promotion, behavioral health specific. As you can see, there's tax and revenue data, there's some commercial data there. And so that's a great resource, though, for seeing what's out there. And prescription monitoring data right now, the CPES prescription drug monitoring system data is now available there, including dashboards. CT Data is who's our partner in developing our portal, is built more on the sense of data, democratizing access to data and building data capacity. I wanted to highlight they also happen to be Connecticut State Census Data Center with a link to those resources. So there's an entire data center interface that allows you to really look at that census data, the American Community Survey data in depth, and the data topics are listed here. Okay, and then DPH, the Department of Public Health, their data set is not that easy to navigate, mainly because they do a lot of different things. So, here's just a list from chronic disease and injury surveillance, healthcare equity and quality, health information systems, infectious diseases, maternal and child health, the tumor registry, and hospital and ED data, which feeds the syndromic surveillance system, which is part of the chronic disease and injury surveillance system. So that's Epicenter. Syndromic surveillance system, which takes hospital and ED data by ICD-10 codes, diagnostic codes, and feeds it into a surveillance system. And that's where you'll get your monthly reports on suicidal ideation and self-harm. There's opioid data that gets presented through that syndromic surveillance interface. There's there's a variety of different sources. And then the youth risk behavior survey that I talked about, as well as the behavioral risk factor survey, are both included in DCF. I mean, in DPH. And then this is just a slide on the YRBS, because I wanted to, make you aware that the YRBS is Connecticut's school health survey. And there is data. There are reports that look like this with breakdowns by subgroup, which is really helpful in our prevention work. EdSite, this is my friend Jen's, one of my friend Jen's favorites resources, so I wanted to make sure to highlight it. That has a host of information if you're working with schools and school districts. Profile and performance reports, those report cards. There's enrollment, absentee rates, suspensions, expulsions, graduation rates. There's data on identified populations within the educational system, teacher demographics, all sorts of things. So that's EdSite. And then a data source that's not like pretty much any of the rest of these is the Data Haven. Basically, Data Haven focuses on quality of life, equity issues. They break data down by community types. There are town and regional profiles, both focused on equity issues and community well-being. So you'll see metrics here that deal quite a bit with the community experience, with safety, with access to mental health and behavioral health care, access to physical health problems. This is a resident survey, has a fairly large sample size, which allows them to do town and regional profiles. So I could talk about that for about an hour and a half, and I'll leave it there. To let you know that whole social determinants of health and equity piece, we lean very heavily into these data. And then there's our prevention portal. And this is where CPES comes to the table. So our SEOW prevention data portal, we are not the only portal, as you can see in the state. What we do is pull data together around prevention and health promotion. So we don't own any of the data that's on our portal. It's all publicly available. What we do is help to organize it and use it to develop products and raise awareness. It is informed by our state epidemiological outcomes work group, our SEOW, hence SEOW in the name. And it's been in place for maybe 8 years now, I want to say. Right now it's undergoing a complete overhaul. We've done usability testing, gathered a lot of information, and are in the process of kind of revamping it. That said, what I can tell you is one of the major products of this are the epidemiological profiles, which kind of lay out all of the dimensions of the problem for all substances and some mental health issues and problem gambling. So we look at prevalence, risk factors, consequences, all those things I talked about at the beginning of this presentation. We update them biennially. COVID kind of threw a bit of a monkey wrench into that because of the lack of availability of trend data. Right now, we are in the process of taking the state profiles, expanding them to state regional profiles, and making them far more visual than they currently are. Another resource are the DMHAS regional data stories, which basically break down each of the DMHAS regions by data across sectors and issues. So substance use, demographics, educational data, mental health data, housing, and a host of other things. And these are completely interactive. So I won't link to them now, but feel free to go ahead and play. And then other products. So all of our products are data driven. So presentations you can find on the portal, info briefs, reports, guidance documents for different processes, which I'll talk about in a minute. Here's an example of one of our more recent cannabis retail infographics. And our cannabis EpiProfile companion info brief will be on our new portal as part of sort of our revamp. And it will be in our products tab very shortly. And then we do annotated data visualizations, graphs, charts, slideshow, PowerPoint, slide decks, maps, those sorts of things. And some of this can be crowdsourced. So if there's something you're not seeing, if we hear from enough people that it's needed, we will go and build it. And then the most recent acquisition product that we have is Connecticut's substance use primary prevention resource assessment map. And this came out of a community-based substance use primary prevention resource assessment that we conducted over the course of a year with the local prevention councils that Jen mentioned, and developed an interactive map where you can filter by funding type, prevention strategies. You can overlay that community type designation that Data Haven uses, so you can look at what these communities look like in groupings of wealthy, suburban, urban core, urban periphery, and rural, and there to see what kind of the systematic differences in prevention, implementation, and funding are by those groups, and that helps inform work going forward. So just quickly on kind of what our plan is for this revamp, we're simplifying our landing page. We're creating a drill down to downloadable data that kind of enhances capacity building, which I'll show you in a second. We're adding infographic issue briefs by substance and issue, as I told you, redesign of the EPI profiles, reorganization of products by type and area of focus, restructuring of the core data library, which is our indicator matrix, to simplify searching, group indicators, and assign quality ratings to those. All right, so I'm going to stop for 1 second and just show you that this is kind of what our new drill down will look like. A lot of strategic planning went into this, but so you start with a topic tile, you move to a summary infographic, selected visualized data elements, so graphs and charts, and then the downloadable data elements. All right, so I'm going to stop there for a second. Any questions, any comments? I know I went through all of this very quickly before I move on.
Anyone have any questions? You can drop in the chat or feel free, I can unmute you. Nothing coming up, Jens. Go ahead.
Okay, awesome. So that's kind of where we come in. So, introduce myself again. We are CPES, and so we are a DMHAS funded resource link. About Jen, how long has TTask been in existence? Almost 10 years?
A long, yeah.
Okay, so about 10 years ago, my mentor, Dr. Jane Ungamak in the Department of Public Health Sciences, and I responded to a request for proposals from the Department of Mental Health and Addiction Services. Prior to that, UConn Health was doing evaluation work with DMHAS from initiative to initiative. So something would get funded, UConn would provide evaluation services. At one point, DMHAS had the immense wisdom and presence of mind to turn to a resource link system for evaluation and data, as well as capacity building and training. So hence the RFP for TTask and CPES. And so with a vision, Jane and I responded to this RFP, and the rest is history. This is what our original charge was, to very broad, to identify, collect, analyze, interpret, disseminate data, track indicators, develop and maintain a portal, share findings, provide research and statistical expertise and support, and provide training, capacity building, and TA. That's where we started. At this point, we see our work in sort of core functions, and those core functions really are data curation, evaluation, and capacity building. So, so data curation, we talked about the SEOW prevention data portal. We also disseminate data via social media, so our Facebook, our Instagram, and we have a team that is focusing pretty heavily on that at this point. And then data product development, so those epi profiles, info briefs, slide decks, presentations, and we are working with DPH on a suicide prevention dashboard right now, to pull suicide prevention data, as well as homicide data together into a dashboard. And then what drives all that work is our state epidemiological outcomes work group, which we convene quarterly and is chaired by our coordinator and Angela Duhame, who's in this meeting right now on the DMHAS side. On the team level, we have a data core comprised of an analysis and visualization team and a product development team. And those two teams meet and come together to cross-pollinate, to share expertise, to pass things off. So the analysis and visualization team will feed the product development team. The product development team vision will inform what the analysis and visualization team does. This is a relatively new thing, and it's been about 8 months, and we're loving it. Evaluation. A lot of people who know CPES don't realize we do evaluation, which is really, like I said, kind of our roots. So we develop plans and instruments to assess progress and the impact of DMHAS funded prevention initiatives, as we have for decades. We collect and compile data, and then we share the results and recommendations back out. Most recently, we shared recommendations back out to the Alcohol and Drug Policy Council, Prevention Subcommittee, to inform recovery-friendly workplace progress and next steps. So our project evaluation team is kind of the group that does that. So right now we're doing evaluation for the Partnerships for Success grant, which is a DMHAS community level prevention grant from SAMHSA, the Preventing Drug Overdose grant, which you some of you folks may be more familiar with, and the state opioid response grant as well. Then finally, this capacity building piece, which is really kind of where my heart is at this point, to increase the capacity of prevention partners to utilize data. And that's you all. Honestly, that SPIF, we go back to the SPIF circle and other prevention, planning frameworks, and that's where we build capacity. So we do that by providing guidance documents and worksheets for particular processes, trainings and presentations, TA consultation and office hours, and then instrument development for communities who are looking to gather data, or if the state needs an instrument to assess something, CPES is available for that. The biggest work we're doing right now with regard to this really is the regional priority report process. That there's a biennial planning process that the regional behavioral health action organizations undertaken. We are knee deep in that process right now. And all of these elements have come to bear on that process. So we have done all of those types of work with that process. Again, we also support DMHAS community initiatives like the Partnership for Success, and the Prevention in Connecticut Communities Grant. And then finally, we work with the local evaluators who are working with prevention communities, as well as some, health department initiatives, and are always looking to expand that group to pull local evaluators in to share best practices to support the community work. And we work fairly closely with TTASC's evidence-based work group to use that information to establish best practices. So this is our team. This is the fun part. These are the faces behind the work. And so we have a management team that includes Dr. Megan O'Grady, who's an associate professor in the Department of Public Health Sciences. And there's me, and there's Marsha Murray, and her focus area is more evaluation, product development, branding, and management processes, whereas mine is more data curation, capacity building, and regional planning process. We both form part of that data core team that I told you about. This is our analytics team. So Janice Vendetti provides analytical guidance, data planning, mentorship, also part of the data core. Christine Guaret is our clinical research assistant extraordinaire from Clark University, who does primarily the data analysis, instrument development, and evaluation support. And then Yang Liu, who's our graduate assistant, who also does analytical support, epi profile development, and data management for the SEOW prevention data portal. On the evaluation side, we have Alversa Wade, who's a Master of Public Health graduate from UConn. And her focus areas are evaluation support, implementation support, data product development. She's also part of the data core, as is Sydney Tabor, who joined us recently. And again, her focus is evaluation and data product support. Allison Weiser, who you can see has an MSW background, has worked more on the DMHAS side of things, but she's worked with CPES for a while, and she does evaluation support for the Preventing Drug Overdose grant. And then finally, in this group is Kemi Suleiman, who's our other graduate assistant, and she, along with Yang, is doing epi profile development in addition to evaluation support. So you can see how our team is multidisciplinary. You can see that their backgrounds are all different. There's cross-pollination, and that their focus area also, they fit into the teams in different ways. I guess that's what I really wanted to say, is that their area of focus, they also pull that area of focus into a more of that team-oriented focus. And then because we're at the Department of Public Health Sciences, we enjoy the benefits of being part of a university. And so here, this is just a summary of our affiliated faculty and staff. And as you can see, focus areas from community-based research in maternal child health to women's rights, trauma ACEs, health service research, SBIRT, substance use prevention research, suicide prevention. So we really have all the bases covered where we need them to be. So that's kind of my story on all of this. And I guess, kind of the only question we have for you is, what can we do for you? How can we inform your work? How can we plug in to what's going on in the state outside of DMHAS's core prevention framework? How can we improve public health in the state through our work? Things we can do for you are answer your questions, conduct trainings, direct you to data, provide guidance, and then share information, tools, and products. Those are just some of the things we can do. With that being said, I thank you very much for your time and your focus. And my contact information is here. And again, this presentation will be shared. So with all that, I'm going to open it up for you all to talk.
And Jen, if you want to take down your screen share.
I will.
Awesome. Thank you so much, Jen. I know that's so much information and available data that CPES puts together for everyone. And people are always looking for information from the local level and where it can all be found. So this is really helpful so that we can provide this presentation to everyone. And I know that everything is linked in the presentation for everyone. So you can dig into there and play around with it, like Jen said. So today's goal was to really put everything into one place for everyone so that you can access it when you have time and the specific needs that you might have as you do your work and in your communities. So with that, we have some, I have a quick question, Jen. Do you meet with local evaluators that work with LPCs with their youth surveys?
So, we meet any local evaluator is welcome to join the local evaluator work group. We don't we have some LPC local evaluators. The cadre of local evaluators is relatively small. We find that local evaluators do work across communities. So yes, there are some LPC local evaluators, but we're really looking to expand that. We know that the local prevention councils need support, and local evaluation applies to anyone. So, but we don't always know who those people are. So, if you have a local evaluator that you would like to kind of connect with us, we're definitely happy to meet with them. One of the things we're working on right now between the local evaluator work group and the evidence-based work group is developing core data elements for local prevention councils to be able to utilize. Some of you may have participated in an LPC survey conducted by TTask several months ago. And we're using that data to try and build supports for local prevention councils and other communities who are, have low levels of funding or capacity so that they too can collect data. So that's the associated answer, but the short answer is, to the extent that we're not meeting with if you have a local evaluator, we would love to be able to connect with them.
I'll follow up with Melissa as well. So if your particular LPC doesn't have a coalition-based system in place yet, because some don't, some are really locally, on an LPC community. You can also reach out to the RBHAOs that I linked into earlier in the presentation. So your RBHAO will probably be able to direct you to communities in your region too that do have youth surveys or are using an instrument and provide at least a connection and network for you and a bridge to assist with that. And also feel free to reach out to TTask as well, and we can connect people as well on those things. So please, by all means, either reach out to Jen or myself, or even better, your RBHAO. And if you need to find help locating that, feel free to shoot us an email.
Can you hear me?
Yeah. Hi, Melissa.
Oh, hey, how are you? So I am a part of Catalyst CT RBHAO for Region 1. And I just think with our political climate right now, how can we better assist our LPCs with streamlining within our towns, especially, with all what's up in the air, especially with LGBTQ questions, suicide questions, all of that good stuff. I know this is kind of heavy, but just some guidance on that so we are able to support our local towns and just keep them as streamlined as we can.
Yeah, that's a great point, Melissa. And I think, we've heard this in pretty much every meeting we've been in. Honestly, what are we going to do to safeguard those, those individuals who are probably, who are not only most at risk, but most vulnerable. And how do we do that without data? Quite frankly, because what we find is that at the local level, those populations tend to be invisible in some of our more standardized collected data. So this is something we've been thinking a lot about, and I definitely think we do need some guidance for how to substantiate the issues that groups like that are facing, and how to kind of standardize focus for how to address those issues. So I don't have a good answer for you. Local data collection is, I think, is kind of the key to unlocking that, but maybe not maybe focus groups, maybe listening sessions, qualitative data collection as a start to document the story. But we'd be happy to discuss this further and to pull maybe a work group together to address that whole issue. It's actually something we've been thinking about for National Prevention Week, is pulling together community folks to discuss the whole issue of what do we do about local data in this, specifically in this political and federal climate.
Thank you for that. I was hoping, with being the LPC lead here in Region 1, I wanted to use our quarterly meeting to really address this, to see, how are the municipalities reacting to kind of all of this political climate mess that we're like seeing throughout the whole state. So I'll be sure to reach out.
Okay, sounds great. And I mean, I'm going to say my one political one political comment of the day is, for example, just because we stop talking about population doesn't mean that the work stops. It means that the work moves forward. And you're lucky to be in a state where, where that work is supported. And it's all at the local level.
Any other questions? Okay, I am just going to, before we close out, let me just stop recording.